Breaking news. A monster is currently terrorizing the United States of America. Experts have identified the monster as Healthcare-Zilla, and its damage is stretching over the entire United States. Many citizens have been affected by the monster, causing widespread urgency to find solutions to the problem. Dr. McKenzie and Tom Latkovich were quoted in a Time article saying, "Do not panic over healthcare costs. We may finally be on the cusp of learning to control them. The key," he says, "the entire system must shift to paying providers based on results, not tasks." Many people around the country are working hard to find solutions, but we still need help. Please, citizens, we urge you, if you have ideas on how to solve this monster crisis, please call this number.
Hello, is this the news station talking about the monster?
Yes, it is.
Awesome. I think we should focus on the groups most affected by the monster. So, for those who don't know yet, a large majority of women have been misguided by healthcare professionals for years about their health needs and bodily actions. This causes them to spend more time and more money on treatments that they don't even really need or won't work for them. The price of healthcare has gone up while the quality has gone down. With affordable healthcare, more women will be able to receive the treatments they need. I found this guest blog on the Society for Women's Health Research website titled "The Cost of Being a Woman in the U.S. Healthcare System." The blog included the following data. For women living with chronic conditions, access to healthcare through their health plans is confusing, restrictive, and unaffordable. 41% said they couldn't afford their deductible last year, and nearly half worry they won't be able to afford it this year. I believe that we should spend more time educating people on the benefits of affordable healthcare, decrease drug prices, and expand insurance coverage. With lower cost comes healthier people, and who wouldn't want that?
Elders are one of the groups of people that are affected most by the healthcare system in the United States, and one of the biggest reasons for that is because of pharmaceutical drug prices. Elders tend to rely more on pharmaceutical drugs to maintain their health because lots of minor problems that can be fixed or limited with the use of pharmaceutical drugs tend to start appearing around that stage in life. Now, the reason that drug prices are so high is because they're being purposefully kept high by certain pharmaceutical companies via a process called evergreening. Evergreening is when a pharmaceutical company creates minor alterations to a drug product, and these alterations don't really affect the function of the drug, but the drug companies do that in order to be able to legally market it as a new drug. The reason pharmaceutical companies want to market new drugs is because there's an exclusivity period after new drugs are released, where generic brands can't copy or sell a version of the new drug. So the pharmaceutical companies can raise prices on that specific drug and can be the only company selling it for a period of time, leaving all the profits to them. An article by the Committee for a Responsible Federal Budget describes how drug manufacturers are often able to take advantage of the current rules using evergreening strategies to extend their exclusivity periods. The repetition of this process can cause a loop of purchasing overpriced drugs for many elders, and really any person who has been prescribed a certain pharmaceutical drug. The solution to preventing evergreening is simply passing laws to restrict or dilute the process and effect of evergreening. One example of that could be a law that shortens the length of time before generic companies can start selling the same version of new drugs. The reduction of pharmaceutical drug prices is a great way to reduce healthcare costs overall.
We don't need expensive drugs now that there's no more evergreening.
Yes you do.
We can go and buy generic drugs now.
My...
Those solutions are great and all, but what about nurses? Not even talking about future problems, but stuff happening now, such as burnout, which affects 62% of nursing community. And napping it off isn't gonna fix it. Imagine being so tired that you couldn't even do anything. You don't want to rest because if you do, you feel like it would cost someone's life. Well, that's a nurse. When a nurse does decide to quit, it creates the cycle of getting burnt out, quitting, then making it harder for those you left behind, leading them to become tired, which is why nursing shortages have been a problem. Experienced nurses are starting to leave due to the stress levels of their job or simply just ready to retire. By the way, the ANA Resource Hub is a great site to learn what and how burnout affects our nurses. It also gives insight to how to help. But back to what I was saying. It feels wrong just to save those on the outside while not trying to make sure it is okay on the inside. I wouldn't come on here if I didn't have any solutions to this, so I propose we increase the education for nursing degrees. I also say we shouldn't make certain degrees/courses so challenging to get into. Not to say they shouldn't be challenging at all, but to offer to more people. We need to start making sure our nursing schools are up to date and are conveying everything a nurse should face. Also, we should give more nurses time off.
Hello, I heard about the healthcare monster and I think I have a solution. Low-income individuals and families are impacted most by the healthcare monster. Access to quality healthcare should be a right, not a privilege, yet for many families it remains out of reach. There are many challenges. Many low-income families face barriers such as lack of insurance, transportation, and awareness of available services. According to a study by the Case-Your Family Foundation, uninsured individuals are less likely to receive preventive care and treatment for chronic conditions, which leads to poorer health outcomes and higher healthcare costs in the long run. These aren't just statistics, these are real people. As Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhumane. We must address this injustice head on." One crucial step is expanding Medicaid and other programs to cover more low-income individuals and families. These programs have proven effective in improving access to care and reducing disparities. According to the Center on Budget and Policy Priorities, Medicaid expansion has been linked to significant gains in coverage, access to care, and health outcomes. Also, educating people about this program will dramatically improve costs of healthcare, allowing them to receive the proper healthcare they need. Beyond coverage, we need to invest in community health centers and mobile clinics that bring care directly to underserved areas. These facilities provide essential primary care, preventive services, and health education, often at little or no cost to patients. Also, this would allow patients not to have to travel to healthcare centers, so the transportation costs would dramatically lower and they would not have to worry about having a car. We also need to address the social determinants of health, such as poverty, housing, and food insecurity, which significantly impact health outcomes. As the World Health Organization notes, the conditions in which people are born, grow, live, work, and age all play a crucial role in their health. Improving healthcare accessibility for low-income families is not just a moral issue, it's an economic one. When people are healthy, they are more productive, they miss fewer days of work or school, and contribute more to their communities. By investing in their health, we invest in our collective future. We need to work together, not alone, to ensure that every family has the opportunity to live a healthy and productive life.
Well, all those callers gave us great ideas, but we still need your help to take action against this monster. Thank you for joining us. We'll see you next time.
I'm like, hey, what's up?